So we have heard a lot today, and I want to just start with, unfortunately we didn't have time to do a report out from each of our tables, but I thought we'd start with, from your own table discussions, what stood out to you about what was said that came out of your discussions? And I'm going to start with you, Tom.
Oh, okay. Thank you. Thank you, and thank you for having me here tonight. From my table, we had a fairly heavy representation of Manchester, and Manchester, in many ways, as many people here know, they've had some of the biggest challenges, but they've also had some of the most robust response to those challenges. So what I've taken away from our discussion is, number one, that there is a huge amount of enthusiasm for tackling the issues of substance use and behavioral health, that it looks like we may be having a reasonably good start with the work that's being done both with the integrated delivery networks and also the Doorways program. And some of the needs that we discussed were having that ready and easy point of access so that at the moment you need help, it's there for you with a knowledgeable person on the other end of the phone or in the facility that you present to. So to me, it was very hopeful that we have, at least in Manchester, we have some really dedicated and intelligent people moving forward very rapidly to address the issues, well supported by their local hospitals.
Thank you. Sheila?
At my table, I had nice representation of middle, high school, and college level. So it was great. We really focused on not only what's happening within schools and how to get the message out and educate people more from middle school and up, but also some personal issues that some of our table members have faced and ways that they've received solutions. We had different parts of the state. We had public school and private school. So it was interesting to hear different takes from different folks.
Thank you. Tim?
Yeah, thank you. At our table, very similar to Senator Sherman's, I think there was a lot of good conversation around the systems that have been built over the last few years, the doorways and other systems, the mobile safe stations, and how are we, how successful have we been in addressing building those systems to get people to help? I think there was some conversation around where we need to go next, which is how do we make sure that after or during the receiving of help or after people have found recovery, how do we make sure that we're tending to the whole person? Access to job training, access to housing, making sure that all of those other things are available to help people succeed most is a place where our state is really struggling and I think has some opportunity to focus. The other thing that came up, we had a representative from the college at the table and I posed a question around just recognizing that there is pretty significant evidence of how behavioral health issues are impacting college students and incoming freshmen, and what are things we need to be thinking about both with partners in higher ed, in the young adult community, for whom these issues are quite critical. And there are systems that have been built that are targeting adults. There's work that's being done for younger people, but what do we need to be doing potentially or thinking about on the college level?
Great, thank you. And Peter?
Well, we had a great discussion, and I think there were some themes that came out of that, and I was really happy because there was a theme of optimism in the group, and I think that optimism is sort of fueled by some years where things haven't been so easy, and I think everybody who's in this room agrees that you've got to have optimism and you've got to have hope, and if you don't have those things, then you know, our journey is much more difficult. So there's sort of this idea that we have come together as a state and really lobbied for a higher conversation about behavioral health. And with that comes an understanding that the stigma is getting in between people actually getting help. So people feel that we're on the right track, that we're in the beginning of our own journey of recovery for the system. And if we're telling the story right from a news perspective, if we have an engaged legislator who can understand the problem, then I think that optimism is well earned.
Thank you. So now we're going to pull back a bit for the bigger picture. We heard speakers today from a variety of areas of the mental health field or experience with the mental health field. We also, at our tables, you got to experience more ideas and more viewpoints from that. So as leaders that represent different areas of engagement with this field, what were some of your big takeaways? Is there anything that has changed your viewpoint, that has got you thinking in a different way? I'm curious to see what your takeaways are. And Sheila, do you mind starting us off?
Sure. Explain what you mean by takeaways from what we're seeing from
the discussions tonight, whether it was from our speakers, from your table discussions, in general, what from tonight has impacted you?
Sure. I think just listening to everybody's story, hearing how different people are finding ways to find solutions. I love that we came together for solutions. There have been a number of other instances where I've been part of discussions where we talk about the problem and we continue to talk about the problem. So having a group of people that are like-minded in that we are finding ways to get beyond talking about the problem and moving forward is really inspiring. And so to hear everybody's stories, whether they were up here talking about things or sitting at tables and mingling with people, we all have a personal connection to mental health. Whether we talk about it openly or we, come to it by being able to sit at a table with someone and say, I've never shared this story before, but let me tell you a little bit about where I'm coming from. I think that these are the opportunities that I'm seeing here with the group of people that we're with today.
Thank you. Tim, how about yourself?
I actually want to go back to something Ryan said when he spoke about different voices. And I'm a fan of Ryan's. I've heard him speak before. So he himself is not a different voice to me, but I think he's right. And I think I've just appreciated, I see a lot of people in the room I know, but some I actually don't. And given my role in the circles I travel in, I notice that when I'm in rooms with a conversation on these issues where there are new voices, new faces, at least to me, that I can learn from. I also am thinking a lot, and this has been on my mind outside of this conversation, but some of what Ryan talked about really hits it for me as well. And all of you who shared your stories is, I echo Peter in feeling a fair amount of optimism and energy around this epidemic as one that is solvable and that there are solutions and that New Hampshire is actually a roadmap of how good solutions are done to a community in crisis. While I also realize that that is cold comfort to people who have lost loved ones and families for whom these solutions were not in place. And I think that as we have conversations around solutions, I'm not a person in recovery. I, like almost everybody in this room, I would imagine, have had certainly personal touches with the diseases of behavioral health in my own life and in my networks. But I've been in this field since I used to talk to a lot of empty rooms. And nobody covered this issue, nobody talked about this issue, and people died silent deaths. And even now, I talk to a lot of families who are angry. Yes, they're excited, they're at the table, but they're angry because they have lost, and it is their loss that drives them here. And so I think as we think about hearing people's stories and hearing those voices, we take that optimism and be energized about it and use it to keep us going, while at the same token, I think we as a community have to wrestle with the reasons that we got here, which was 30 years of inaction. And I don't know what that reconciliation is, but I think that very much still has to be part of our conversation and still continue to drive our desire to make sure that we get ahead of it, because if we don't, this will happen again. And I think this is our shot not only to drive solutions to the opioid epidemic, but solutions that will drive the issue of addiction, which is bigger, and will always be with us to a point. But I don't want to sit here again in 10 years when another substance is claiming a lot of people because we didn't have our ducks in a row. So,
Thank you. Peter?
So Ryan, I'm going to pick on you again. You know, something that you said that really made me think was you said, my story is boring. By the way, it's not. It's a story of a disease, and it's a story of recovery, and that is the most inspiring thing. But what you said next was the piece that I really sort of latched onto is, but here's my story of recovery. Here's my story of what happened then. I think we run the risk sometimes of telling a story of a broken system. And I worry about that. We have a workforce problem in this state. And if we're going to go around saying we're the second worst provider of behavioral health services, you know, we used to be number one, but we're number X now. I don't want to tell that story. I want to be somebody who tells a story of, but here's the upswing. Here's what recovery really looks like. And the more that people tell their stories in an authentic way, the more people are going to listen. You know, and I think about the work that we've done with Justice John Broderick, the number of people that come up to him and say, I thought I was the only one. I thought I was the only one that felt like that. I thought I was going to be judged, but you're not judging me. The ability for us to tell those stories instills hope in the system, not just the individuals, and makes people think that's somewhere I want to be. Because this work is the most rewarding work in the world. And I think it's not, you know, rocket science. It's way more complicated than that. But there's so many people who want to do this work. There's a lot of work to be done, but there's an awful lot of us to do it.
Thank you. Senator?
Well, this is very complex. There's no great soundbite for this. Taking some of the message from my table is, one, optimism. Two is that there are an awful lot of parts of the state that are not Manchester. They are hugely underserved. I was at Cheshire Medical Center not too long ago, and they don't have a psychiatrist. They lost their psychiatry program because they couldn't bring in a psychiatrist. So in my committee, we started talking about, well, why doesn't Cheshire have a psychiatrist? Well, they need money to offset medical school loans. Oh, well, we have that program, we just never funded it. If you look at the history of New Hampshire and where we have been, we have a lot of good intentions, but we've never funded them. We had the last 10-year mental health plan in 2008. That expired in 2018. Guess how much of it, we could ask Ken, how much of it was actually implemented. So, but right now, in the legislature, we have a lot of hope. We have yesterday's signing of SB 11 to end ER boarding. We have at least 5 more bills coming through to fully implement the 10-year mental health plan. This is not a stump speech, but this is about optimism. And speaking to what you both have said, implementing the 10-year mental health plan, it's a blueprint that will work for New Hampshire, but we have to fund it. And in the legislature, I think the biggest frustration is that we have a 2-year election cycle. 2020, everything could change. The defunding could recur. But right now, we're all working together on a blueprint that supports the hope that I've heard expressed here today. So if we follow that blueprint and address people currently suffering with mental illness, my pet project, if there is such a thing, being the son of a child therapist, is to really, at the same time, focus on the children. We have the victims of this crisis, whether it's behavioral health or substance use, currently in our DCYF program with a national standard of 12 children with 1 caseworker. In New Hampshire, it's 45 children. Talk about burnout in terms of manpower. Those challenges are huge, but we need to have In my book, we need to be starting at birth. And one of the bills, SB 14 this year, is actually starting to do that. You start at birth with the supports that will allow children to grow up into healthy, not just physically, but mentally healthy adults. That's the root of what we're trying to solve here today in my book. So the optimism of what I've heard at my table, the optimism I feel in the legislature right now as we start, seeing bipartisan support, moving things through, getting the governor's signature, really putting money where our mouth is, which is super important. And then I would love to see us, as those are moving forward, shift and really look at the kids and really make sure that those kids are growing up healthy, because that's going to be the best defense against us ever having to live through this again. It gets right back to what Tim was saying, and I still remember your first presentation probably almost 7 years ago, and Tim said, we don't have an opioid problem. This is, I think it was on the task force. We don't have an opioid problem, we have an addiction problem, and we've had an addiction problem for ages in this state. And that starts with the kids. And so that optimism I'll carry forward from tonight. Thank you.
And that leads perfectly, thank you. And I'm going to combine my last two questions because we are getting tight on time. But we heard a lot of call for actions from our previous set of speakers. And I'm sure, there's a lot of thought going on in the room about each of us, what our next move is here in our roles. So can you talk a bit about, first, what's next for you? What's your call to action that you're working on next? And then what is your challenge to our audience? And Tim, I'm going to start with you.
Great start with the funder. No, first of all, let me just say, I just want to thank the News Collaborative for tonight and for all of the work, phenomenal work you've done together. And I know that many of you in the room are journalists who have called me, and I'm happy to take your calls. But again, in reflecting on my own experience of speaking to empty rooms, while I would not wish this epidemic on this state, period, I never imagined, never in my wildest dreams, that I would be in an environment where legislators and public officials and the press were just dogged on trying to wrap our community's arms around this issue. And so just thank you for not only your tenacity at sticking with this topic, but the dignity at which and the commitment you have to cover it with dignity and cover it for what it is and what it isn't, and break down stigma and just help be a partner to us. So just thank you. I'm thinking a lot, and again, some of it's in the conversation tonight and at my table and in some of our speakers, but I think for folks who don't know, we have a private fund. We're the Community Foundation. We have a fund that's focused on addiction. We fund a lot in youth substance abuse prevention right now, as well as supporting the nonprofit sector. I think there are a couple of things that really resonate with me in tonight's conversation. The first is, I think, thinking about self-care, which is something we've done a little bit with some resources to try and make sure that first responders, clinicians, are able to do a little bit of that self-care that they need to do at this crisis moment. But I think about that broadly for anyone on the front lines, because I do think, and tonight really proves it, we've redefined, I think, who's frontline. It's the clinicians, it's the moms and dads, it's the reporters who are embedding and covering these issues, it's all of us. And what are we doing to, keep the oxygen mask in place? So I'm thinking a lot about that. And I also, not to poke on Ryan again, but I do think we have to think about still how we treat other illnesses, because there are ways we approach the treatment of other illnesses that we do not still with addiction. That includes every effort to keep a patient alive until such time as an appropriate treatment could be made available. Surgery, you name it. And so I think we need to begin, as we are continuing to focus on making sure people can get the treatment they may ultimately need, how do we help those that may not be at that stage of wanting to find their recovery still be safe so that they can be around long enough to find it? And then the last part is what we do after. Because I've talked to a lot of, thank you. Thank you. Because I've talked to a lot of people in recovery. I'm not a person in recovery who've said, my recovery is great, but if I don't have a job, I don't have a place to live, what's it there? And I think we need to be a little more thinking about the whole person at every stage of the trajectory of the illness and into recovery, and making sure that people are getting what they need at every stage, not just that moment where they're ready to ask for help.
Thank you. Peter?
I think the call to action, it's funny because I was just thinking, I've worked in the substance use disorder arena, child protection, and in mental health. And there's stigma attached to all of those three, especially not only for the people who struggle with that, but the providers who provide that service. And sometimes we get into our silos and we want to get our blame in before blame comes our way. And our best self is not that. Our best self is having the ability to practice appreciative inquiry, to ask more questions and make less assumptions about somebody. And the big assumption that I think we should all make is that everybody who's doing this is doing it for the right reasons. Everybody's heart is in the right place. Now, it may have become a little hardened because of compassion fatigue. It may have become a little cold because nobody's been listening for a long time. And it may have become a little blamey because I just don't want to be blamed myself because I'm so used to that. I think it's opening up that heart. I think it's opening up yourself to self-examination, but to have conversations with other people that actually come from a good place. Tell me why you got into it. We do orientation. Why did you get into this business? And everybody has a story, regardless of who they are. Even the people that come to work who are landscapers at our place tell a story of why they've come here. So I would say not only optimism and hope for the future, but an understanding of why people want to be in this business and for the good. And I'm really taking that away from tonight.
Thank you. So, Tom?
I would, first of all, my table has reinforced a few things in my mind. I have been a huge proponent and think of the opportunity of being in a small state that we can further coordinate our care across the state. So there aren't pockets, but that everybody has everyone else's experience and knowledge available to enhance programs across the state. Take what works and put it in another part of the state. So what that means in real terms is being able to provide a structure, and this would be through legislation most likely, that would allow us to pool our data, our experience, and then also provide feedback and coordination, not just in pockets or in regions, but statewide. Being able to do that needs assessment, strategic planning, being able to really provide services across the state, not just where there's the loudest noise. The second is the strength to move forward with really taking some bold steps on supporting the children. And I hate to keep coming back to that, but that is all about prevention. And the third is we were asked, what can you all do? Hold us accountable. That's really what it comes down to. Don't ever stop coming to testify. I think Ken has a seat of his own in the Health and Human Services hearing room. But I'm absolutely serious. And those who have testified, those of you who are doing such great work locally are the most powerful voice for your patients, clients, whatever you like to call them. I like to call them patients. But to make sure that we in Concord are doing our best for them. Your stories drive legislation. It powers us forward. And there's nothing more powerful than a story like Ryan's, which we've talked about this before. And it really just sort of propels us into doing some of the right things. So keep your passion local and then bring it to Concord and make sure that those of us who are trying to make sure that the 10-year mental health plan is being implemented, that you are fully supported in your communities, are also fully supported in the work we're trying to get done. Thank you.
Thank you, Senator. And Sheila, you get the last word of the panel.
Great. Well, and I appreciate, I kind of got a segue in about talking about children, and that's really where my passion is children and adolescents. Have been working with them for 25 plus years, and have seen a lot of broken things happen along the way. Was driving up to Concord regularly when the Chins Law was being changed. And now I'm seeing another side where we're seeing some of these other things happen that need to be happening, like the suicide prevention bills that are in front of people now, things that can help to change the voice of not only mental health providers in schools, but all teachers, administrators, parents, everyone who's working together to help kids become more healthy physically, emotionally. My next step is to continue to be a loud voice. I am one at my school. At Sauhegan High School, I try to destigmatize mental health every day, as my daughter said, talking about it all the time. I'm out in the middle of the hallways, I'm putting up things, I'm sending out emails, I'm posting on my Instagram for kids. I want everybody to be talking the talk and walking the walk. And so that's my passion going forward, trying to spread that out to my social work cohorts around the state. And I would just ask that we continue to keep strong mental health supports in schools. It's amazing. I worked residential care for 22 years, and I thought, oh, I'll just downshift and go work at a school. No. Mental health does not discriminate, and it's a pretty fast-paced life that I'm working in a high school right now, where there are parents who say there's nothing wrong with my student, and I've got their student every day crying in my office. So, educating people, talking about it, keeping us in there, and not having social workers on the chopping block is going to be important moving forward.
Well, thank you. And please join me in thanking our excellent responder panel.